Hello, everyone. Thanks for joining my internship presentation today. I will be talking about my summer internship I did at UNC Health, where the aim was to evaluate the supply variance and the cost containment opportunities within the Department of Electrophysiology. So my agenda for today is to discuss about the project that I worked on, the components, and show the dashboard that I created as part of the project. So, firstly, a brief about myself. I am a graduate student in biomedical and health informatics program. And prior to this, I have done my bachelor's in dentistry, and I also have a master's degree in public health. After which, I worked as a systematic reviewer in a startup organization. And then I did my summer internship at UNC in the Department of Diagnostic Cardiac Services. So, talking about UNC Health, so it is one of the largest integrated healthcare systems in North Carolina, and they have healthcare facilities across all the counties of North Carolina. And UNC holds the mission of excellence and leadership and providing the best care to its patients and the best research opportunities. So coming on to my project, the project started off in May, where we just worked on developing the project charter and setting the project goals and doing the user group and need analysis. Then initial data tables were prepared. And I got the opportunity to visit the electrophysiology operating room, which was where I gained a lot of useful insights about how the is conducted, the different supply items that are used, and the cost of the supply items. Then by June, the data tables were ready, and I started working on creating the visuals based on the data. And by July, we had the dashboard created, and we used to have bi-weekly meetings with our stakeholders. And based on the feedbacks and suggestions, we updated the dashboard and finalized the dashboard. And once the electrophysiology dashboard was ready, we replicated the same dashboard, just adding some more variables. And we replicated the same dashboard for the Cath lab. And in August, we finalized and published both these dashboards online in the UNC domain and started working on the documentation part of the dashboards to get them certified. So the objective of this project was to answer the questions such as, are there any opportunities for supply contract negotiations and to look for the cost saving options? And are there any unnecessary supply variations that are leading to extra cost? And the motive was basically to develop a dashboard that serves as a tool where we can answer all of these questions and look for areas of improvement. Then coming on to description of the project. So the data for this project, it was taken from Carolina Data Warehouse, and this data was set to update on daily basis. And some of the key variables, they were directly extracted from the data set, and some of the variables, they were created so that we can have more meaningful comparisons during the analysis phase. And some of these key variables were like procedure category, the primary performing physician, the supply cost, vendor cost, and then direct margin was calculated by subtracting the account charges from the account collected. And then we had different payer categories made like Medicare, Medicaid, private, and self. So the tools that were used in this project were, so we used SQL and business intelligence to extract the data from the data warehouses and create variables and develop the tables. And these tables were finally compiled in the Excel spreadsheet. And I just imported the Excel spreadsheet and used that to create the dashboard and data visualizations in Tableau. So coming on to the dashboard, So cannot show the actual dashboard. So I just have the screenshots of the dashboard and I'll try to explain the functionality through these. So the first one was to see the EP supply cost by case, in which we had the average supply cost categorized by the different procedure categories and the primary performing physician. And on going through any of these different procedure categories, we could drill down on the individual cases of within that category and the supplies that were used in that category. And also, if we wanted to see the other way around, we connected the first and the second dashboard through this navigation button, where we can see like the opposite thing. Like if we want to see like an item type and what all procedures that supply item is used, we can just click on the supply item and it will show us all those cases where that supply item was used. So also showing some of the filtered options that were there in the dashboard. So we had the reset button to get everything back to original. And then we had the date filter set. So if we want to look at the data during some fixed time range or refer to some particular date, we can directly select it from the filter. Then this top and bottom filter was specific to the cases chart, where if we just want to look at maybe just the top one and the bottom one case, we can directly have the option to navigate just one case or maybe 5 cases up till like 10 top and bottom cases. Then this dashboard the purpose of this was to see the supply items and the different vendors that provide that supply item. And on clicking on any of these categories, we could have a more detailed look at the different item types and their unit cost and how many of those items were used and their total cost. And some more other components of the dashboard was adding in the last refresh date and time. So we know that dashboard is being updated on daily basis, and the information button where we have the instructions. So like the user can have go through the instructions on how to navigate the dashboard. So in terms of functionality, the additional component in this dashboard was this menu filter, which where if the user wants to have a look at the case by case detail, they have the flexibility to choose between the case detail or just maybe looking at the trend over time. And so they can directly look at the trend and what has been the average staffing cost over that time period. Uh, in terms of function, this dashboard is exactly like the previous dashboard, and the purpose was just to see the average direct margin over a period of time. And we also, like the previous dashboard, we also had the opportunity to see it by case detail. Okay, next, this was this representation was done to see the volume of all the procedures over time and have a look at all of them in one visualization. Then the last dashboard was for us to see the pair distribution. So within each of the pair categories, if we click on any of the pair categories, we can have a drill down for the individual pairs within that category and also see the collection that has occurred over the time within each of the pair categories. Okay. So finally, after the dashboards were ready and they were published online, so we worked on the documentation of the dashboards. So this is just like a sample of the Excel workbook, which we use to document the dashboard, where we add all the images of the dashboard and just define the key terms and all the components of the dashboard. So this documentation was done for both electrophysiology supply dashboard as well as the Cath lab dashboard. So this tool is accessible to all the members in the UNC Health, and it is particularly helpful for identifying the cost saving options and answering all the questions that we discussed as part of our objective. And it will help the operational leaders to advocate for any needed practice changes, and they can look for any vendor negotiations and track the data or that like daily refresh data and what are the changes over time. So that is the purpose of the dashboard. So the challenges, so I did not face as such any major challenges in the internship, but most of it was like some technical issues, just setting up the Citrix system and working on some of the advanced functions of Tableau. The communication problems were mostly, I would say, due to the technical reasons of connecting to the WebEx system. And because the US healthcare system is sort of new to me, so just to understand how the supply chain and healthcare system functions here was challenging to me. But my team was very supportive, and I was able to overcome most of the challenges by the end of the internship. So my learnings from this internship was that I got to work on a large healthcare data set and sort of work with the team on collaborating with meetings and work with Dale, understanding how business object is used, and also working independently on the dashboard helped me enhance my data analysis visualization skills. And overall, my interpersonal skills were also enhanced a lot during the internship. In all, my internship experience at UNC was very rewarding, and the skills that I've gained here will be helpful for me in my future roles. And I would like to thank Dale, my supervisor, for his support and guidance and giving me this opportunity. And also, I would like to thank the entire team at UNC for their valuable feedbacks during meetings, and Mariel for always the prompt responses and guiding on each of the internship deliverables. And thank you all for being part of my presentation today. Hope you have a great day. Thank you.